or related, you know. So some guys commented and I didn't actually see. Hi, death or tai chi. I'm not discussing what do they call it? I'm not discussing some traditional medicine here. I'm discussing the real medicine, right? So, all right, let's continue. So we'll talk about two conditions that are linked, and this is the avascular necrosis and also bone infarction. Avascular necrosis and bone infarction. So for avascular necrosis, just have to do it. Just get the story. What is vascular? Blood supply. So when you see avascular supply or avascular, the blood supply is disrupted or the blood supply is cut. Do you understand? So avascular necrosis and bone infarction just involve death of tissue, and this is because what? The blood supply has been impaired. So the defined location, clinical context, and presentation. Okay, so that's what we got. So avascular necrosis is death of bone tissue due to loss of blood supply. Typically, usually affects the epiphysis, that's the long ends of the bones. Common site is the femoral head. Okay. Sorry, I'm coming. Okay. So what are the causes? Causes could be due to all those traumas like fractures, dislocation, can disrupt the blood supply, corticosteroid use, alcohol abuse, sickle cell disease. Then sometimes the cause is not known. It could be idiopathic. So clinical features is what? A lot of joint pain, limited range of motion, progressive collapse of the articular surface, then okay. All right, so if you do imagings on MRI, it will show that there's bone marrow changes, to show bone marrow changes. Later the x-rays will show what? Crescent signs, collapse of femoral head. Okay, so how about bone infarction? So bone infarction is just what? Ischemic necrosis of bone tissues. Usually these affect the metaphysis or diaphysis of long bones rather than the what? Epiphysis. The first one we said that affects what? The epiphysis. So that's the differences between what? Avascular necrosis and bone infarct. So bone infarct will just be in the middle of the bone, while the what? Avascular necrosis is usually on the head. So causes could be sickle cell disease, corticosteroid therapies, traumas or vascular occlusions. Clinical features is sometimes no symptoms, sometimes just pain, but it's little pain. Then it's less likely to cause joint collapse compared to avascular necrosis. So on x-rays you see what? Salpingous sclerotic border around the infarcted area. So MRI also shows marrow changes. Okay, so that's what we have for these two issues.